We're back with our health lead now. As the opioid crisis continues to grip the nation, highly potent synthetic drugs are also becoming more prevalent. The DEA says drugs like fentanyl are up to 50 times more potent than street-level heroin, which is why it is often mixed in with the heroin, sometimes without the user's knowledge. The New Hampshire State Police shared this photo of 2 lethal doses, heroin on the left, and on the right, a deadly dose of fentanyl. Just 3 milligrams is enough to kill an average-sized adult male. Now, 2 senators have introduced bipartisan legislation to address this growing crisis by attempting to stop the shipments of this drug from coming into the U.S. Joining me now from Capitol Hill is Minnesota Democrat Senator Amy Klobuchar and Ohio Republican Senator Rob Portman. Thanks to both of you for being here. Appreciate it.
Thanks for having us on.
So, Senator Portman, let me start with you. The two of you introduced the STOP Act. It's aimed at curbing the shipment of these synthetic drugs into the U.S. How much do you think this will actually stop the problem?
Well, it'll help, Jake. And what was not explained earlier is the fact that this is coming through the U.S. mail system. So as opposed to heroin, which primarily comes overland from Mexico, or other drugs, crystal meth coming from Mexico, or produced in America, this is produced for the most part overseas and then shipped to our country via the mail system. What law enforcement tells us is it's impossible for them to find the packages that are suspicious packages to try to stop some of this poison from coming into our communities. If we would just require the post office to provide some information, as other carriers have to provide, UPS, FedEx, other private carriers, it would really help them to be able to identify suspicious packages and stop some of this poison from coming into our communities.
Senator Klobuchar, the drugs are obviously being shipped into the country because of the high level of addiction. It's a true crisis. So how can we also help combat the addiction where it starts?
Exactly. 4 out of 5 heroin users in this country, Jake, got their start on legal prescription drugs. So we not only have to do something about things like fentanyl, that, by the way, killed Prince in Minnesota, but we also have to stop people from getting addicted in the first place. That means better standards for when doctors prescribe these things. You don't need 30 pills when you get your wisdom teeth out. It means monitoring these drugs so the doctors know if someone's been doctor shopping, and Rob and I also have a bill on that to make that mandatory, so states
are to plug that bill.
There you go. So states are sharing data across state lines. I had one guy in Minnesota, 108 different prescriptions from 80 different doctors from 50 different cities. True story.
Stunning.
So they need to be able to share that information across state lines. And then, of course, treatment money. We just got $1 billion at the end of the year, and just this week, with the bipartisan deal on the budget, over $100 million more.
And Senator Portman, let me ask you, the new health care bill in the House will allow states to opt out of a number of things, including mandating that insurance companies cover substance abuse. Are you concerned about that?
Yeah, I'm concerned about it. Actually, I'm concerned about something even more that has to do with this same issue, which is treatment and longer-term recovery, which is that Medicaid expansion, which 31 states have, including our states, is providing a lot of the treatment. In fact, in Ohio, we think it's about half, and it's by far the largest provider of treatment for this opioid addiction crisis. So in Ohio, we are seeing more deaths and overdose this year than ever before. Sadly, that's true nationwide on average. So the problem's getting worse, not better, and Medicaid expansion is a major payer here. In fact, it's about 30% of the people in Ohio, mental health or substance abuse treatment. It's 50% of the cost. So I'm concerned about the health care bill, partly because it changes Medicaid expansion in a way that I think does not provide the kind of glide path or softer landing for this program to ensure we aren't pulling the rug out from under people at a time when we need more treatment.
And Senator Klobuchar, you mentioned all the different other problems that have created this opioid crisis in this country. One of the biggest problems that we've covered a lot on the show is that a lot of these opioids are being pushed by drug companies. Yes, they're prescribed by doctors, and yes, patients doctor shop. But what could be done about the pharmaceutical companies and their responsibility here?
Well, some of that is going to come out of what the DEA allows for production, and I've supported caps on that. It's also what we've seen, and that's a Drug Enforcement Administration. Also, what we look at for what gets approved and for what use. I think that's something else. And basically, I think we need to be pushing the pharmaceutical companies to be developing other kinds of treatment options that are not addictive. They have pushed these things out there. I think they're going to be held accountable. There's already, some of them are backing away. There's some lawsuits that have been filed. And I think that we're going to find a lot of them knew how addictive these were. So that is a whole different topic. I'm one that is willing to take on the pharmaceuticals, Medicare Part D negotiation, that's my bill. Drugs from Canada that are less expensive, that's a bill that I have with Senator McCain, and I think this has got to be part of it, and it's something that we told Governor Christie when we went over to the Executive Office building in the White House to meet with them about what the administration needs to be doing too.
All right.
In legislation we've already passed, the Comprehensive Addiction Recovery Act, which was passed last year, we provided that the NIH had to study this issue and come up with non-addictive pain medication research, really important. And second, that HHS had to convene an interagency task force on this very issue to help encourage these drug companies to provide pain medication for important pain management that is not addictive. This is one of the big problems right now, is we don't have the alternatives out there that we need. Right. So this is part of the legislation that's passed. It's been authorized. Now it's up to the administration to actually implement it.
Well, it's a huge crisis out there, as I know you both know. Thank you so much, and thanks for working in a bipartisan way to get something done. We appreciate it.
Thanks, Jake.
Thank
Thanks
you,
for covering it.
Sheriff said